Your health. It's the most important thing in the world and the one thing most of us take for granted. You never know when it's going to fail you, but one thing is for sure, the best way to protect your health is to be well informed. Welcome to Your Health Matters. I'm Peggy Pico. Today on the show, we'll talk about one of the world's greatest killers, cancer. It's the leading cause of death across the board. It shows no bias for ethnicity, gender, or age. But as you'll see from our 3 survivors, there's one simple step you can take to beat the odds. Now, you may have heard it a lot from your dad or granddad, son, or husband. Why go to the doctor unless it's really, really, really bad? Unfortunately, that kind of procrastination could cost a man his life.
It was a urination problem that I had. I went to the hospital, to the emergency room. They prescribed going to a urologist to have it looked at. It's kind of scary, obviously, finding out that you have cancer.
Email Lukey isn't that different from a lot of men. Hey, if it's not broke, then why fix it?
There was no history of prostate cancer in my family.
With no family history of prostate cancer and no serious symptoms to warrant a checkup, Email's diagnosis floored he and his wife Susan. But once the shock subsided, the process of fighting the cancer began.
We've always kind of preached to the kids that you need to be adaptable and you need to be able to look things in the eye squarely, and it was time for us to walk our talk.
They came to Dr. Sojia Misra of Eden Medical Center to learn all they could about the disease.
Prostate cancer is the most common cancer in males above the age of 50, and African Americans have a higher incidence of prostate cancer. Other risk factors include diet, hereditary factors. Men with a family history of prostate cancer have a much higher incidence of getting prostate cancer.
The best way to combat this cancer is, quite simply, early diagnosis.
A PSA test is a very simple blood test. As long as a diagnosis is done early, so that treatment and cure is readily available.
Even in some cases where the cancer is not found early, advancements in prostate cancer treatment have been essential in lengthening the patient's life and providing him with greater comfort.
We did the saline TURP at Eden Hospital, which is a very new method that I just started doing over there. Blood loss was expected to be a lot, but with the new method that we have introduced at Eden Hospital, the procedure is almost bloodless.
The Lukey's decision to be active participants in his treatment has greatly improved his odds of survival, and they credit a lot of the success to teamwork.
You just get the feeling that everybody really cares at this hospital.
Yes, absolutely.
We're a team.
Once we know the facts, we can deal with them, and that's how we operate.
That's how they operate. Now, Eden Medical Center is an approved community cancer center as designated by the American College of Surgeons. Their cancer program provides a wide range of diagnostic, treatment, and support services for cancer patients and their families. Now, joining us today is Dr. Tyler Kang. He's an oncologist at Eden Medical Center, and thanks so much for being here and telling us kind of more information about what we can do to prevent cancer before it gets out of hand.
Thank you for having me, Peggy.
Yeah, it's great that you're here. We saw a little spot of you in that last picture. At the very end of that story, we were looking at some video. What was that what we were looking at?
So that is a procedure, it's called transurethral resection of the prostate, and it's basically where the urologist would use an instrument to help open up the prostate gland in those people who have bladder outlet obstruction symptoms from prostate enlargement.
But it seemed pretty clear. It looks like you're able with the new equipment over there, or the equipment over there, I should say, to actually get a very clear look at the prostate. Is that helpful?
That's always helpful. It's when the surgeon can visualize what they're doing, it makes it a lot easier for them to do their job.
We touched a little bit about this in the story. You know, men sort of delaying when they go to the doctor. When it comes to prostate cancer, what are some of the symptoms men need to look for and say this is the time to go to the doctor?
So prostate cancer symptoms really mimic symptoms from other prostate diseases such as benign prostatic hyperplasia. So symptoms such as frequent urination, incontinence, frequently getting up at night to urinate, hesitancy, if they have any pain or blood in their urine. These are symptoms that they need to watch out for, and if they become apparent, they need to see their physician.
And the sooner the better, correct?
Absolutely, yes.
Okay, because?
Well, when we talk about cancer, when we can catch them early before the disease spreads, it always allows us an easier time to control or to take care of the cancer.
Okay, and what if, because I know some guys will be watching this like, I don't have any of those symptoms, therefore I don't need to get checked. When should a guy go in for a PSA test, even if he doesn't have any symptoms?
Well, that is actually a pretty controversial topic. In the past, and over the past 2 decades, there has been a lot of media attention about increasing PSA checks and doing examinations by physicians. But certainly in folks who have a high risk, such as African Americans, people who have a family history of prostate cancer, they probably should begin their check at the age of around 50. Certainly if their family history is strong, then they may want to do it earlier than that. But it's always important for them to talk to their physician and discuss the implications of doing a PSA check.
Well, it seems like if they come to you or they come to some of your colleagues over at Eden Medical Center, they get the treatment, let's say they even have prostate cancer, how long does it take before somebody can go back to work, resume their normal sexual activities, basically kind of get back on track?
And the time from therapy to back to their normal life kind of depends on what type of treatment they do. It could be for example, if it's just a simple resection of the prostate with what we saw today in the show, it could be a matter of just days. Sometimes if it's a major surgery that they need to undergo, then that could certainly take several weeks to recover.
But they can get back.
Yes.
That's the key. They can get back. Well, there are so many factors at work when treating prostate cancer, but it's only one part of Eden's cancer care. When we come back, the good news about a recent medical breakthrough that could eliminate cervical cancer.